Hi guys, it's Mark Thompson from Thompson Chiropractic and Superior Recovery and Performance. Today I was going to talk to you about upper and lower cross syndrome, and what that means is if I look at you from the side, you have some really tight muscles and some really weak muscles. And in that situation, what happens is it leads to forward head posture, tremendous amounts of pressure on the back of your neck and the upper back. So we're going to talk about normal posture would be me standing here like this. My ear canal should be roughly in line with my shoulder, and upper cross syndrome would be tight upper chest, weak upper back, and very tight along the suboccipital region of the skull, and I've got weak neck flexors. And what happens is that leads me to do this. My shoulders roll forward, my head protrudes, my chin is out, and now my ear is dangling over nothing, and all the stress from the 8 to 12 pounds of my head being cantilevered out over the front is right here. So we're going to talk about how to fix that in 4 simple steps. Thanks. So the first exercise, the first stretch that we're going to do is for the upper chest, the pec minor. And what you do is you stand in a door jamb with your hands about head high or higher. And then you're going to take a step with either foot to just take the pressure off of your low back. And you're going to lean in and down. And when you do, you should get a nice stretch across the top portion of your chest. You can also do it one side at a time. So same thing, my hand on the side that I'm stretching is at least head high. Take a step in with the same foot, and then you're going to lean away and down, and you should get a good stretch across the upper chest. So this is the doorway stretch. So the next thing we're going to do is called the door pull stretch. And what I'm going to do is I'm going to stretch the muscles between my shoulder blades and my upper back, because those are weak and we want to activate them. So a nice stretch is the first step. So what I'm going to do is I'm going to grasp the doorknobs on a door. I'm going to put my feet spread about shoulder width apart on either side of the door, and I'm going to lean back and I'm going to stretch like this. You can also do one leg back at a time, but I prefer both. And then just try and elevate one shoulder at a time to get a little more stretch on that side. At the same time, you're kind of rounding your back as you're doing this stretch. So that is the door pull stretch. So the next thing we're going to do is we're going to stretch the scalene muscles in the neck, and there are 3 of them, and so they all attach up here, and there's an anterior, a middle, and then a posterior, and then across overlaying all 3 of those, you have something called the sternocleidomastoid muscle. We're going to stretch all of those, so it's basically one stretch, 4 different positions, okay? So if I'm going to stretch the left side, I take my left hand and put it behind my back, and that pulls my shoulder down a little bit. And then I'm going to tilt my head to the right, and as you can see, I'm really tight right in here, and I feel it in the middle, with my head just tilted to the right. And as I leave it tilted and look up, now I can feel that same stretch in the front part of my neck. And then I'm going to leave it tilted and then kind of look down. Sometimes I actually even kind of rotate my head away, and now I feel it down the back. The last one for the sternocleidomastoid muscle, or the SCM, is we're going to keep the head tilted away from the left shoulder. This is the side we're stretching, so we want to leave it tilted to the right, and then I'm going to rotate and look up at like a 45-degree angle, and I get a really good stretch on that muscle. So that's how we're going to stretch the neck muscles. Hang on, one more thing. One in our series on upper cross syndrome is something I affectionately call the chicken neck, because that's exactly what it looks like. What happens when you have that forward head posture, your head goes forward, your shoulders roll in, all of the stress goes to the upper back and the lower neck. This exercise actually helps free that area up and gets those vertebrae able to move. And so this is what it looks like from the front. You're going to place your hands on a table or the counter, and you're going to lean on them so that you keep your elbows and your shoulders nice and tight. They shouldn't move at all. And then the only thing that's going to move is your head up and back. All right, so here's what it looks like from the front. So I'm going to go straight down and then straight back. On the backward side, I'm actually trying to pull my head back to give myself a double chin. You want to just have your head translate straight down and straight back. You're not nodding like this. This doesn't help. We're going to go straight down and straight back. So from the side, again, leaning on a table, weight on my arms to keep my elbows and shoulders tight, and I'm going to go straight down, straight back. And you're going to do that about 10 or 20 times or until the base of the neck feels like it's loosened up. So that's it for upper cross syndrome.